the subject, COVID-19 or the coronavirus. And before I begin, I will introduce the speakers. We have Andrea Ramos, and she is the founder and CEO of Healthy Friends Nutrition. And the mission of Healthy Friends Nutrition is to improve the quality of life of families through the use of fresh foods, taking a holistic approach. Then we have Dr. Sharon Henry Woodby, and she's an internist with subspecialty in infectious diseases. And she's very active with Zonta and was very active, let me say, in having a referendum passed in the state of Florida against domestic violence. Next, we have Dr. Reza Nagavi, and he is an internist, and his focus is wellness. He has modernized his practice more or less. I don't know why Dr. Nagavi isn't here right now, but we will go ahead. Myself, I will moderate. Is he on yet? Is Dr. Nagavi here? No. I have another name besides Mignon Smith. My name is Nana Ama Ajuan Kodie Boma Ekosohima, which means Queen Mother of Development in the village of Boma. And myself, I was founder and president, remained president of the Global Associates for Health Development Incorporated. And Dr. Henry Woodby is a member of our executive board. So let us begin. Andrea, will you start out, please?
Yes, I will. Thank you. So let's see.
Apologies for interjecting. However, I just wanted to announce the welcome of Dr. Nagavi, who has entered.
Do you want me to go ahead?
I don't know. Dr. Nagavi, thank you for being present. Are you practicing today, or can you stay on to the end? 10:30?
Stay on. I think you have it set up that you're going to finish before 10 o'clock, so I can stay on, hopefully.
Thank you. All right. Let's hear from you, Andrea.
Okay. Good morning, everyone. So as Dr. Smith indicated, I am the founder and CEO of Healthy Friends Nutrition. I am a clinical nutritionist and a personal health chef. And a health chef means that I cook healthy in order to address any medical or health concerns or issues. 11 years experience in the clinical settings in hospitals and extended care facilities, as well as community-based and government agencies. And my governing agency is the Academy of Nutrition and Dietetics, in which I'm an active member, and there are various subgroups as well that I am a part of: pediatrics, diabetes, etc. So I'll just jump right in, and we're pretty much discussing the immune system when it's in a crisis like the COVID-19. So pretty much treat your body well, and that indicates to maintain a strong immune system. If you feed it well, keep it well, then your immune system will be strong. That's the proactive and the holistic, the holistic way of taking care of something, rather than being reactive and taking care of it after the fact. Your body is very resilient and it protects you more than you even know. And I say that because we beat up our bodies. By yo-yo dieting, we're killing our bodies. Trying new fad diets, we're damaging your bodies. And so many systems within our body replenishes itself. The cells replenish themselves. If you damage your liver, it rebuilds itself. So we are damaging ourselves in so many ways, and we're actually lucky that the body is that resilient. Do what's going to last, and that's sustainability. You want to eat a way that you can eat now until the end of time. Cabbage soup diet is not an option because you can't eat cabbage soup for the rest of your life and think that you're going to continue on a healthy path. And no carb diet doesn't exist because you need carbs in order to live and in order to get your energy. And then, of course, we're not being extremely strict to that. Of course, there are treats. So what to eat and how to eat it. So I have percentages next to our macronutrients here, pretty much because that's just an example of what one person's diet can be. This is not a copy of everyone doesn't have the same percentages of these macronutrients. So for example, 30% of your eating should be proteins, 50% carbs, and 20% fats. Within that, there are lots of nutrient-dense foods. Proteins we should work on are lean meats, and if you're vegetarian or vegan, things like quinoa, couscous, brown rice, these whole grains have proteins as well as they are carbs. So that's the healthy versions of getting some proteins if you do not eat meat. Another thing we have to do is stay hydrated for sure. Our bodies is approximately 75% water, and we need to keep our bodies hydrated in order to function. Dehydration is real. When we are dehydrated, it causes so many health concerns and issues, and you would never even think that is caused by being dehydrated. When I say stay hydrated, I don't mean juices, I don't mean sodas, but literally water. You can doctor up your water by squeezing lime, lemon, cucumbers, lots of varieties so that it has some kind of flavor so that you can tolerate it. Teas are also can also be utilized as hydration, provided you don't use sugar in it or a lot of sugar. So herbal teas, decaffeinated teas, all those flavors can give you the flavor, and that could be counted as your waters. And then if you eat fresh fruits and vegetables, they have water in it as well. So those are the healthy versions of keeping your body hydrated. 7 to 9 hours of sleep is crucial. And that's there's no way of making it up. So you can't sleep 5 hours tonight and think that the next day you're going to add 5 hours to make it up. Once it's gone, it's gone. So 7 to 9 hours is what's recommended for healthy, sustaining your body and continuing on to be healthy. And knowing what a serving size is very important. This doesn't lead to endless and mindless or emotional snacking. For example, who can eat a whole bag of cashew nuts? I mean, I'm sure we all can, but literally 1 ounce is a serving, and that 1 ounce is approximately 190 calories. So imagine what eating a whole bag will will do to your body as far as having so many calories. Next, so many of us know of the pyramid as far as a guideline as to how we eat, as far as the proteins or the various levels of foods and nutrient foods. Now we have the My Plate method, and no, the pyramid no longer exists, even though we do see it if we Google it, but this is what has replaced it. So it's a visual, and this came out when First Lady Michelle Obama was in office, and it still is used today. So it incorporates a visual of what your plate should look like. A quarter of your plate should be the starches, a quarter of your plate the protein, and the whole half of your plate is fruits and vegetables. So this is what your plate should look, and you can see the liquid or the drink of choice is water. And this is what's easy. So if you wanted to show this to a child, this is a visual aid that is very much easier to understand than the pyramid method. Eating the rainbow. So each plate, each meal, whether it's a meal or a snack, we try to get as many variety of colors as possible. And each color represents a different vitamin and mineral. So rather than someone trying to plan by counting macronutrients, micronutrients, etc., we can just pretty much make a variety and know that we're getting our vitamins. So we have the reds, that's like vitamin A and C, and you can see what they are, watermelon, strawberries, red peppers, red onions. Oranges and yellows is high in potassium, beta carotene, lipocene. These are bananas, lemons, grapefruits, pumpkins, etc. Greens, folic acid, calcium, etc. And they are cucumbers, the green grapes, honeydew, avocados. Avocados is a very good, healthy fat. We have white, which that is to build a strong immune system. And that is our garlic, our onions, our mushrooms, ginger, turnips, and things along those lines. And then our purples and blues, which what's big for me is I love to do eggplant in so many various ways. But we have our purple cabbage and blueberries fall under this category. And staying hydrated, to just expand on that, what it does, or the benefits of drinking water, is you have better metabolism of your fats. It decreases your cravings, which I wanted to discuss. A lot of times when you are hungry to the point of feeling like you're starving, which you should never actually get to that point, just try to have a glass or two of water and sit there for 15 minutes and find out if you're really hungry or was that really thirsty, being that you were dehydrated. Many times it is that you are on that cusp of being dehydrated. So water can fulfill that hunger pang in many cases. It flushes out the toxins from your body, which is very good. It's good for your skin, complexion, and just so much more. So how do we make these changes from either eating unhealthy into trying to eat healthier and trying to be more nutrient conscious? It's going to take time. So anyone that has any health issues, whether it's diabetes, whether you're obese, whatever the case may be, those concerns didn't happen overnight. So in order to rectify them, it's not going to happen overnight, which is what many of us want to happen. So we have to plan our meals. If you're an executive and you're going into the office and you're having a meeting, you have to plan your meeting. Everything in life that works is a plan. So you plan your meals. Now, in many cases, there are varieties of ways of doing it. You can calorie count. You can count your macronutrients, which are your proteins, your carbs, and your fat. You can weigh your foods, whichever way. I mean, there's lots of ways that people don't want to do it, but they're, or the My Plate is a visual. So that can give you a guideline. But planning is key in having this process work. Exchanges slowly over time. You're not going to just go from the way you eat normally to cold turkey and just start eating salads and fruits and everything in a day. So you take it slowly. You like, let's see, I don't know, something you like fried chicken. So now you want to implement a healthier version of fried chicken. You could do oven-baked chicken, oven-baked fried chicken. You can replace your white rice with brown rice, little by little. And a lot of people, including myself, didn't really like brown rice, but how I made that transition was to saute garlic and onion and then put the steamed brown rice in it and sort of stir fried it into having more flavor. Herbs and spices are your friend in this. As we decrease our salt, we increase our herbs and spices to give your foods more flavor so that you don't miss your salt.
We have about 2 more minutes.
Gotcha. I'm almost done. Portion control is knowing how much you eat for each serving. And then just be mindful, as I said, of what you're drinking. We're not drinking our calories by drinking the juices and sodas. So I just want for you to just keep in mind, if you learn how to eat, you will learn how to live. We want you to live your best life ever simply by using fresh foods. And I will end with a quote that I have come to believe that caring for myself is not self-indulgent. Caring for myself is an act of survival, by Audre Lorde.
Thank you very much, Andrea.
And I have contact information if you wanted to take a picture of the screenshot. But thank you so much for having me.
Our pleasure. I just want to state that what Andrea brought out and what the rest of us will be portraying is what we have to do is maintain the integrity of the cell. And the cell consists of protoplasm and the outside of the cell is mostly protein. The protoplasm consists of carbohydrates, which is basically carbon, hydrogen, and oxygen. And in order to maintain balance and optimum performance of the individual, we must have the proper proportions of each of these nutrients essential in place. And I thank you very much for your presentation. Now we will hear from Dr. Nagavi. Dr. Nagavi will speak to us about COVID-19 and
that's okay.
The epidemiology, no, the etiology and the pathology and treatment. It's what goes on with the patient. We only hear about statistics, the media, but Dr. Nagavi will bring more of that to our attention.
Good morning. This is Dr. Nagavi. I hope that this finds everyone healthy and happy. And we're going to talk about a topic that's sort of taken over today's life for every person on the planet Earth. If you can give me 1 second, I'm going to add my screenshot to this. Can you see the screenshot?
Yes.
Can
Yes.
everyone see the picture? Okay, good. So coronavirus is a virus that's been known to us for several decades. It has been the common source of infection, especially in the winter months and the fall, where it has affected respiratory tract infections and others. The particular coronavirus that, or the COVID-19 or the coronavirus family that we're dealing with is of the beta genome of this family, which has in the past shown to cause severe acute respiratory distress and Middle Eastern respiratory symptoms, and now the COVID-19. The mutation of the genes shows a resemblance or an identical resemblance that this virus initiated with a bat from the bats, and it migrated to other mammals, particularly this civet or a carnivorous animal, and then it jumped to the human being. First, we saw a similar version of this about maybe 20 years ago, where it caused several thousand deaths in the Middle East, and then it showed other relations from that were not from the Middle East and not dissociated with any contact from direct person to person, but it was mostly a new penetration into a local area. Coronavirus has shown itself to be, or COVID-19 has shown itself to be a pretty significant function is to disrupt the red blood cell oxygenation by attaching the beta cells of the red blood cell and being able to disrupt the oxygenation process and the dissociation of the oxygen from the red blood cells into the other cells, into the periphery, into the organs, and so on and so forth. And that's how it seems to be penetrating into the host body, interfering with the oxygenation. Also, it is using receptors of ACE1 and ACE2 throughout the body, and it seems to be more concentrated in areas of the body that have more of these receptors, and that's how it's causing more of a multi-organ destruction involving the lungs, involving the liver, involving the intestinal contents, involving the heart, the kidneys, and other organs, including the brain. COVID-19 is also has been associated with microvascular events and macrovascular events, causing a variety of coagulopathies and coagulations and DVTs and PEs and other things that have indirectly and directly led to the patient's mortality, morbidities and mortalities, and the length of the disease itself. As I mentioned earlier, the beta chains of the hemoglobin is the first mechanism that it finds itself to adhere to the host and start to cause a destruction. And using the ACE1 and ACE2 mechanism, it finds itself to penetrate into the cells and be able to disrupt their regular metabolism of the cell. Coronavirus it has proven itself to be a very highly contagious virus and be able to show itself that it has the capabilities of infecting masses by being able to increase the permeability of the patient's cells by being able to use the vacuoles from a salivary gland, by being able to use droplets, by being able to live on long time and long periods of time on surfaces, and it's find itself to be able to infect more and more people. COVID-19 has had many patients who have been silently infected, not knowing which part of, can you take this out of the, not knowing which part of the, which group of patients have actually been infected, which group of patients have actually not been infected, and being silent carriers of the disease. COVID-19 is affecting, seems to be affecting more adults than it is affecting children. It is carried in animals and household pets, as dogs and cats and other animals within the house, although the infectivity seems to be going from human to the animal, not from the animal to the human. Also, the adult seems to be more where the infections occur and they pass it on to children, whereas usually most of the viruses are infected through the children, to children, and then to the adults, like the similar flu virus that we generally deal with. COVID has also found itself to be affecting more individuals that are immunocompromised, elders, patients with diabetes, high blood pressure, coronary artery disease, kidney failure, a variety of patients with different kind of red blood cell abnormalities such as sickle cells or thalassemias. It's also affecting patients that are more in close quarters. So it's affecting the lower socioeconomical group of patients much more than it is affecting the higher. The closer the close contacts are, the closer the living quarters are, it seems to be infecting more of the patients than the average population will. Healthcare populations, healthcare workers seems to be affected because of the fact that they are being exposed to the virus and they're carrying the virus and so on and so forth. A lot of lack of preparedness has affected our healthcare workers and affected our general population that normally should have been by some of these PPE or personal protection equipment that are really subpar in quality and in effectiveness. A lot of people who thought that they're using equipment that is properly prepared for such a thing, but they really are not. So the amount of protection that we thought that we were getting from, let's say, an N95 mask, being it's a fake N95 mask, we were really just carrying it from one patient to the other, and we were contaminating patients as well. As far as the comparison between coronavirus or COVID-19 and flu virus is that flu virus, usually the transmissibility is about a 1 to 1.5 transmission and the mortality rate of about a 0.1%. Here in COVID or coronavirus, COVID-19, we are seeing a transmission of between 1 to 6 people that could be affected by one person who is infected. But unfortunately, the mortality rate, it is going from 2 to 8% mortality, and which is extremely much higher than what flu viruses has been causing to date as far as mortalities and morbidity. Flu virus is mostly what we recognize as respiratory symptoms of cough and cold, of fever, chills, body pains, and so on and so forth. But COVID-19 seems to be affecting multi-organs. The most affected organ, I'm going to just go back, is the lungs. We are, as it is the first point of entry, the respiratory tract, sinuses, upper airway, and the lungs seem to be causing a lot of sinus respiratory flu-like symptoms. High fever is usually 99% of the time present. Body pain is usually 30 to 40% of the time present. Respiratory symptoms seems to be at least 60 to 70% of the time present. GI symptoms seem to be present at least 5 to 10 to 20 to 30%, and as high as 100% of the patient, or a particular group of patients that just show gastrointestinal symptoms versus respiratory symptoms. The mechanism of action into the COVID-19 seems to be causing disruption of the circulatory system, causing disruption and rupture of the cells, and not allowing enough blood cells and oxygenation exchanges to occur in the lung, causing an inflammatory process and bringing in anti-inflammatory responses in the lung, and causing obstruction of both the microscopic, microvascular, as well as the bronchioles themselves. By the initial injury, a lot of inflammatory processes are coming in and starting to fight. And go back to just my picture, myself. And by being able to attack the cells, by being able to cause the inflammation that it is causing obstruction. By the cause of obstruction, it becomes lobular and eventually pneumonia, or affecting the entire lung at times. A lot of what we see, similar to what we see in an inflammatory process, is we see ground glass appearances in the lung, where indicates that there is an inflammatory process going on. And this ground glass appearance is one of the first, or one of the hallmarks of what we see in pneumonia associated, or lobular pneumonia associated with COVID-19. As far as the body's response to this lack of hypoxia, to this lack of circulation, is more inflammation to try to reduce it. And we sort of start to drain or drown in our own inflammation and our own congestion of the fluids, and the leakage of the tubules and the micro tubules, and into the different capillary systems, into the different organ systems, seems to be what really starts to take the patient down. A lot of the people with COVID-19 infection seems to do worse as a result of waiting and trying to see, what the CDC or everybody else is recommending is try to, wait it out at home and try to fight the infection just like it's just a simple flu, and so on and so forth. So a lot of people, by the time they end up in the emergency room, they're kind of critical, and they end up on a respirator, which ends to have the worst outcome of the patient. We are seeing a lot of microembolism within the organs of the patients. We're seeing a lot of microembolism in the periphery. We're seeing the splinter hemorrhages. We're seeing different necrotic liquefactions in the different organ systems that are presenting to the emergency rooms, or presenting in the ICUs, and so on and so forth. I think the entire picture of COVID-19 is, it's a perfect virus that it's very difficult to treat. If it becomes very aggressive, it could go from anywhere from a lack of a smell to a lack of being able to breathe. It could go from a lack of taste to nausea, vomiting, or diarrhea. It could go from heart failure because of those same microembolisms in the heart, or it could go into kidney failure as a result of both local and regional involvement of the kidneys are concerned. It causes liver problems. It causes strokes in the brain. It causes a variety of different things. So once a patient presents with COVID-19 and is in the ICU setting, this patient could end up to have strokes, heart attacks, and destruction of the organs, whether partial or significant amount of them. As far as the way that we have been treating COVID-19 or this type of viral infection, we've been, in general, or most of the time, just providing supportive care. Supportive care in the making sure that the patient is hydrated because the dehydration will cause the most amount of damage. The patient is able to provide adequate oxygenation. Bronchodilators can be used in patients. Anti-inflammatories have been used or are being used and are of some significance, but also questionable both benefits and detriments to the patient. We are also seeing secondary bacterial infections associated with the COVID-19. And that's why you see a lot of patients being treated with medications or antibiotic, whether they're macrolides, azithromycin, and so on and so forth. As far as other antibiotic or anti-inflammatory cell things that have been used, whether it's a steroid for people who are having a lot of respiratory symptoms to sort of try to dry them up, or even diuretics or whatever, hydroxychloroquine in studies in China has shown, and we say China because they were the first or the beginning that they dealt with this particular infection, showed that they have improved the pneumonia and the inflammatory resorption of the pneumonia in the lung and the recovery of patients, at least enough to be considered for those group of people that are not doing well or not responding well to just supportive care, hydration, steaming, gargling, nebulizer treatment, and so on and so forth. And as soon as we realize that these patients are showing a lot of respiratory symptoms that are not behaving normally, they're not responding to the anti-inflammatories, we have used hydroxychloroquine, 200 milligram twice a day for a 5-day period as a adjunct treatment to the azithromycin or other antibiotics that we have used, with fairly good success. As a personal note, that most of the patients that I have treated have done very well with COVID-19 responses, as long as they have sought early treatment and early intervention. Things have seemed to do pretty well for them. Other medications or other treatments that are available for COVID-19, like remdesivir, which is an antiviral that was also used in earlier outbreaks of COVID infections, and it seems to provide some benefit to the patients by shortening the duration of the infection, sometimes anywhere from 2 to 3 days in the long-term studies, to show that if somebody recovered after 14 days, maybe using the remdesivir, they would have recovered within 10 days. But overall, it's not a magic drug. The serum treatment of people with the serum of the people who were sick, using them as some sort of a booster, seems to be also pretty favored amongst the patients that are critically ill and are not responding well to other forms of treatment, and have proven to be of significant benefits. We have a lot of patients who are walking amongst us who are have been infected and who are not carriers, who will come back as a antibody positive through an ELISA, IgM, or IgG, but when they are not carriers, the swab test will be negative. If they are carriers, the swab test for the nasopharyngeal area will be positive. In order to really properly diagnose, is this person infected? A, how long is the symptoms? B, did the swab test positive now? If the swab test is positive, is the antibody or the ELISA test positive or negative? And if this swab test, and they have, if they have recovered and the swab test is positive, those group of population are still seem to be spreading the virus. Although, due to inadequate testing or inadequate sample collections, we may get false negative swabs in patients who are actually carrying the virus and spreading the virus.
We have about 2 minutes more.
Okay. As far as the sharing of the flu, the COVID-19 statistics are concerned. Can you go to the slide? We have some statistics to share with you in the COVID-19, which is pretty scary stuff. That last slide here. So that one there. Okay, so one of the things that we should really look at is what is shown in the public as to people, number of people who are infected and the number of people who are actually been exposed without being diagnosed. This is a very superficial or very generalized numbers. In January of this year, we had about 2,000 cases and about 200 deaths. In February, we had almost a tenfold increase to 16,000 or 20,000 with 1,000 deaths. In March 1, we had about 100,000 cases with about 3% deaths of reported cases. In April, we have 1 million cases with about 80,000 reported deaths. In May, we have about 3.6 million people who were infected. That number could be 10 times that number, and about 270,000 deaths. In May 23rd, we have 5.3 and about 340,000 deaths. If we look at the exponential tenfold almost growth of this virus almost monthly, and look at the number of cases of people who are dying of COVID-19 multiplying by 30 folds or 20 folds, we could theoretically have about 60% of the population of the world infected, sometimes in the next 12 to 18 months. And we could have at least 6% of the population of the earth come to their demise as a result of this infection. So the question becomes, what are we dealing with here? I think COVID-19 is the worst pandemic that the human race in the modern times, recorded times, has ever seen. And COVID-19 is not going to be going away anytime soon. With the hopes of developing vaccines or antibodies or serum treatment, or, I think that we are fortunate if we have been exposed and have an antibody. We are fortunate if we have not been exposed and don't have an antibody, but we are both in terrible shape because this virus is going to cause not only a complete economical shutdown of the world as we know it, as we have learned, it is going to disrupt the human life and its future generations for decades to come. And it should be taken a lot more serious than opening the churches and opening the bars and the restaurants and so on and so forth. But the question remains, what is the alternative? What do people do? This is a really scary time for us as civilized beings, knowingly or unknowingly. I don't know, what we're going to be looking at in about a year or two, but I know that we have so much to learn about this virus and how it's going to affect our future, our schooling, our education, our transportation, our food production, and so on and so forth, that I am I'm pretty guarded as far as what we're going to have to deal with and where this is going to come. As far as general nutrition, building our immunity, building our community, watching our families, eating healthy, exercising, and everything else, I think they all go along with absolute must. But I think that precaution, prevention, treatment vaccination may be the only hope that the world may have whenever it comes as it comes. Thank you, and I hope that this has been helpful.
Thank you very, very much, Dr. Nagavi, for your words. Thank you. Now, without further ado, we will go to Dr. Sharon Henry, who will tell us about the disease in women and children.
So good morning, everyone. As the slides are getting ready, I wanted to just thank you for having this opportunity to be with you this morning. Go to the first slide. My subspecialty is infectious diseases, and I wanted to spend a little time this morning talking about COVID in women and children. Some of these issues that are affecting the general population affect women and children, but we're also starting to see slight differences, which I want to talk about. Some of these issues also are the unusual pediatric clinical presentations. What should we know? Although rare, we're starting to see some differences in children, pregnancy and delivery issues, and then really important to everyone, but also affects women to, I think, a significant degree, are mental health and stress, and then unfortunately, sexual abuse and domestic violence, which leaves us with the question of, so with all of this, what can we do? Go to the next slide, Cheryl. Next slide. Okay, thank you. I'm not going to spend time on this because Dr. Nagavi really covered it well about what beta coronavirus is. It's an RNA virus. It needs man to really replicate, but it can be on surfaces, which is why we need to be so careful. And I'm going to talk about prevention just to mention things that we need to do. As Dr. Nagavi talked about, droplet dissemination entering through the mucous membranes, which is why we need to be so careful of how we interact with one another. Next slide. All of these things you know, but they're really worth repeating. Proper hand washing, and not that little cursory, little dab of water and a little bit of soap, but for at least 20 seconds, soap and water does kill this virus. Alcohol-based hand sanitizers, primarily those that are greater than 60% alcohol containing. Like your mother always told you, don't touch your face. Mouth, eyes, nose, mucous membranes, the vehicle through which this virus enters the body. I just wanted to mention a couple of things. As states are reopening all over the place, we cannot reduce our vigilance. Social distancing, at least 6 feet apart, we have to continue to do that. Importance of sneeze, cough etiquette. If you cough, sneeze, do it in a tissue and throw it away. Don't put that tissue back in your pocket. Don't put it in your pocketbook. Sanitizing surfaces. And I am really advocating still wearing masks in public. I've seen so many people down here in Florida who have gone out without masks, without looking at their washing their hands, and continue to avoid large groups. Next slide. I'm not going to spend any time on this other than to say at risk, as Dr. Nagavi mentioned, elderly, immunocompromised, higher rates in lower socioeconomic and minority communities, as well as the potential for this hyperactive immune response the body mounts to fight infection. It can be associated with some of the complications we're seeing once the disease is manifest. Can you go to the next slide? So these are all the symptoms that Dr. Nagavi talked about: fever, chills, sore throat, muscle aches, pain, shortness of breath. These you will see in women, men, and children. We're also starting to see some other signs and symptoms of general tiredness. Dr. Nagavi mentioned the central nervous system with loss of taste and smell, and then the vasculitis, which can manifest as a stroke. Next slide. So what are we starting to see by putting a gender-based focus on this illness? Some preliminary data that initially came out of a study in Wuhan, men might have been at a higher risk than women, irrespective of their age. There was a similar prevalence in women as in men, but men seem to have a more severe disease. And among those that died from the severe clinical disease, the majority were elderly, and we know elderly has a higher risk, and 2/3 were men. Now, there are some limitations with this. It was not a rigorous randomized trial to look at this prospectively. It was a preliminary report. It was a case-based series of 43 patients. And also it was done early in the course of the pandemic. So this was reported toward the end of February, beginning of March. But what it does do is raise questions of, are there gender differences, and based upon the correlation with how bad the disease presents itself. And it also raises a question of the mortality, which seemed to be higher in this small case study in men than women. Was it also reflective of women living longer than men in general? So while it raised some questions, we still have more to learn as this disease continues to manifest itself in the general population. Next slide. Now, I wanted to mention maternal health issues. Maternal health concerns during the COVID pandemic are really circulating around the fact, are pregnant women at higher risk because they are immunocompromised? When you're pregnant, you're going to have some degree of immunocompromise so that you can retain a fetus. We're also looking at some differences in prenatal care. There's a limitation, not on care, but on face-to-face visits, and more of a move to telemedicine. So how we're managing, especially if the pregnant woman is doing well, how we're managing her follow-up. Anxiety, increased stress levels affecting the mother, particularly as hospital protocols have started to change and limited the ability of the partner to attend the birth. Some hospitals are starting to release that restriction, but it does cause that additional anxiety for the mother who labors alone. Socioeconomic concerns, Dr. Nagavi mentioned those, and then there's the general fear of coronavirus, and unfortunately, domestic violence and abuse. Next slide, Cheryl. Now, there are some evolving understanding of how this disease may present in some children. You may have heard about an unusual presentation in children called Kawasaki disease-like syndrome. Children in general, as we've just heard, are less likely to get the disease. Only about 1 to 7% of the COVID cases in the US are in young children or children under the age of 18. Now, Kawasaki disease, let me just start by saying what that is. It's a very rare disease. It's an acute pediatric vasculitis, which means there's an inflammatory process going on in the blood vessels. The most severe manifestation of that being a coronary artery aneurysm. It's possibly viral associated. And we heard a few weeks ago about this COVID-related Kawasaki disease that was initially reported in Italy. Now, what stemmed this report was the fact that Kawasaki's disease is rare, but what they started to see was a 30-fold higher incidence in the presentation in children. The symptoms were a variety of symptoms: persistent fever, conjunctivitis, a rash, some lymphadenopathy, swelling of the extremities, but most concerning was shock and multi-system inflammation. These children needed to be treated with IV immunoglobulin and also with steroids. And again, it raises a question of how is this virus continuing to manifest itself in children, in women, in men, which just is going to require us to continue to evaluate these subpopulations as we go forward. Next slide, please. I wanted to mention mental health issues. We're starting to also, because of the quarantine and self-isolation, it can really affect the mental health of anyone. There's worry of what is out of our control. Will I get an infection? Will I pass it to my family? Financial problems, loss of income, paying the bills, feeding the family, loss of our normal social support network due to self-isolation. And most unfortunately is loss of loved ones, friends, family, an inability to mourn by coming together, an inability to even in some instances, bury our loved one. We don't have the ability to do some of the stress-reducing things we had as a framework for coping. Going to the gym, travel. And then there's the tendency to use food, alcohol, substances to self-soothe because we are depressed, because we're anxious. And then there is an underreporting of violence and sexual abuse, not because it is less, because the victim is quarantined with the abuser and is unable to reach out. Next slide, please. So I'm not going to spend a lot of time on this Venn diagram, but it just shows there are pathways linking pandemics to violence against women and children. One is economic insecurity and poverty-related stress, quarantines and social isolation, even violence being perpetrated against healthcare workers. Go to the next slide. So with all of this happening, I did become aware of an organization that is trying to do something about this. And what they have set up is a 24-hour crisis text hotline, which allows the victim, if you are quarantined with your abuser, you may not be able to call 911. You might not be able to make a call and be overheard. So they've set up a text line. And this data is about a couple of weeks old, but what they found was that the top trending words that were being texted out were quarantine, COVID, lockdown, and about 10% of around 600 texts they had received focused on suicide. These were people that just couldn't take it anymore. And they had intervened with some and able to keep some from committing suicide. But what was really disturbing was that 43% of texters were under the age of 13, had a fear of experiencing harm for someone they were living with. While not a huge percentage of the market, also 65-year-olds were texting 4 times more than they ever had. And their concerns around contracting the disease, and then also the loss of a loved one. Next slide. So what can we do? Well, we talked about healthy lifestyle to support immunity. That's number 1. Getting the right nutrition, fruits and vegetables high in vitamin C to help your immune response. Healthy diet, exercising regularly, keep the body moving, get adequate rest and sleep. Andrea talked about that, and stress reduction. Stress reduction, especially as we're moving more towards this depression and anxiety, it's so important to be able to reduce stress. Okay, next slide. Here's some stress reduction techniques I want to leave you with. Put off the news. Don't be glued to Corona coverage 24/7. Stay connected. I will tell you myself, I've never FaceTime, Zoomed, Skyped, and phoned so many people, but you need to maintain a network. Find space for yourself for a moment of calm, even if you're in a crowded quarantine situation. Establish a daily routine. Please don't stay in your pajamas all day long. Say positive affirmation, positive self-talk. Mine is, and it can be as simple as, I am grateful for having another day. I'm grateful for my family and loved ones. I am so grateful that I am able to take this breath today. That's it. Adopt an attitude of gratitude. And one thing that I have done over the years, and I've encouraged people to do, is to focus on the breaths. Slow, relaxed, deep breaths can help reduce your anxiety. Exercise, go to TV, YouTubes, whatever, try something creative, and meditate if you can. Now I'm just gonna show, can you stop sharing for a moment? Cheryl? Cheryl? Yeah. Stop sharing. One quick moment. Just gonna take a minute. I just wanted to show you how easy a meditation can be. I just want you to get comfortable for a minute and take a deep breath in through your nose and let it out slowly through your mouth. You can either close your eyes or you can focus on this picture of a beautiful sunset. See yourself on the beach, as you take a deep breath in and let it out. And as you're walking on that beach, imagine you can hear the sound of the gulls, the laps of the ocean rising up as you take a deep breath in and let it out. Continue to take in your breath, and with each breath, feel your body start to relax as you take a deep breath in and let it out. And see the sun setting in the horizon, and feel the waves. And as you hear the waves, imagine that they're washing all your stress, your anxiety out as you take a deep breath in and take a deep and let that breath out. And remember, as you continue your slow breathing, that you can come back to this breath anytime you want. You can come back to feeling centered and whole. And I will leave you with that thought. So, your meditation can be just as simple as that. It can be 1 minute, it can be 2 minutes. You could work your way back up. And I would suggest, as you're ending your day, try a simple little meditation. There's also meditations on YouTube, but try that moment to reduce your stress, relax your body, because stress is one of the most important things we need to control to maintain our immunity and to maintain our sanity. So I thank you for spending that little bit of time with me, and I hope you have a wonderful rest of the day.
Thank you.
So, Mignon, back to you.
Thank you, Sharon. That was very beautiful rendition of knowledge. Thank you. Thank you to all of our presenters. I just want to say here that we talked a lot about the bats being a source of infection. I like to go further with that to say that in some parts of the world, people consume bats as a delicacy. And they found that also among these peoples, incidence of certain viral disease was high. Another study has been recently, well, it started a few years ago, in another part of the world, whereby people had different ways of preparing foods and the type of foods that they consume. And it was found that the sheddings of farm animals, as poultry, etc., and these animals were killed, cooked, and consumed by families in these areas. Incidence of viral disease was high, especially among the preparers of foods, such as women. I found that to be very interesting. They were the first to be affected, infected, and consequently showed manifestations of the disease. So I'd like to terminate with that and take questions from the audience. So we have a chat box at the bottom, and will you please state your questions for our presenters? Any questions? I don't see anything here. We're so knowledgeable. Do we have any questions? Okay.
I actually do have a question. I'm not going to put it in the chat because it doesn't seem to be a lot of people adding to the chat. But Dr. Nagavi, coming back to hydroxychloroquine and the recent studies that are coming out now, raising some concern about risk versus benefit of hydroxychloroquine and even the potential in some very critically ill patients for arrhythmias to occur. What would you think are the potential utility, what is the potential utility of hydroxychloroquine as data becomes a bit more controversial?
Dr. Nagavi?
Yes. So I think that the hydroxychloroquine should be used sparingly if possible on the population that seems to be most vulnerable or not responding to the initial treatment. I myself have used the hydroxy on hundreds of patients, along with azithromycin, along with other modalities, as long as there hasn't been an underlying cardiac arrhythmia problem, or if I'm comfortable that there is a pacemaker in place, or we are losing a battle that we are not able to control the inflammatory process that is going on as ground glass appearance or other multi-organ failures. I think that's been my personal experience. Use it if you have to, spare it if you can't, or you, I'm sorry, or you don't have to use it for everyone, but those that are not responding to the original treatment, they're not doing as well, the illness is prolonging beyond a week or 2 or 3 or 4. I think earlier use is better than waiting for the last effort because the effectiveness is not there anymore. The initial treatment effectiveness is sort of decrease the immune response with the interleukin-6 that causes the inflammatory process to prevent it or prohibit it from going crazy. So using it earlier is better than using it later. And using it on the population that it's safer is better than not, on the population that is not safer. But I think at the overall look at it, I look at it as a positive tool to use as much as you can to help shorten the respiratory symptoms the most.
Thank you.
Okay.
Any other questions?
But you would not see this as a prophylaxis, I'm assuming.
No, this
Prevention.
is not no, absolutely. This is not something you want to use preventatively because if you don't have a process going on, what are you stopping?
Exactly.
And if you're
Exactly.
stopping the process of your, prolonging your QTs or proarrhythmia and other things, that's definitely not what we want to do. So I think our president is not correct in saying, everybody should buy hydroxychloroquine and whatever. Having them in hand for the very indigent population or a very, very susceptible population even is not recommended because people who need it cannot have it. But I think there is enough supply in the market that be able to deal with this. And I like to look at the statistics of those people who have been on hydroxy or hydrea or Plaquenil or whatnot. Generally for health reasons, whether it's arthritis or some sort of hematological or whatever the problem may be, and seeing their populations of susceptibility to COVID-19 versus those who are not regularly on it. I think that's going to be a long-term study of comparing them in 3 months, 6 months, 9 months, sort of take a survey and come up and say, well, if I was on it, I did better. If I was not on it, I did better, or whatever the case may be.
Yeah, I agree with you. I think that would be a very interesting epidemiological study to do because we have so many questions around it, and I'm hopeful that will come with some clearer guidances because right now it's sort of all a little bit unclear.
Yes.
I have a question.
Yes, Linda.
In regard to face masks, since we're being told that we should wear face masks all the time, and there are so many people who are very interested in making face masks so that we can all have them, should we be concerned about where these are being made as far as the sanitation or the sterileness of the areas where they're being made? the fabrics that they're being made of, and how we're taking care of the masks so that we are still safe. I mean, people are making them in their homes, and you don't always know under what conditions those are being made, and they're being given out. Should we be concerned about that? Should we wash the mask before we wear them for the first time?
What, do you want to go first or no?
More than one question in there, but
Whatever you like.
part.
So I would definitely, if it's a washable mask, I would wash the mask. I also think if you're bringing anything into your home, remember the issue of how long of what we know of the duration that this virus can stay on something.
Yes.
I tend not to bring something into my home without sanitizing it. I think there is a concern if it came in a plastic bag, the outside of that bag, 3 days, maybe the plastic will be, you'll able to get the virus off of. So I think you need to just be treated as you would anything foreign coming into your house. And then I would wash them. Hopefully that would help to a degree. I'm a big proponent of wearing masks because it keeps what you have to you and it prevents you, hopefully, not prevent, but reduce the transmission that you're going to have to somebody else. So I get very frustrated with people who are going out not wearing masks because it's very disrespectful to everybody else you're coming in contact with.
Right.
That's my personal opinion.
So you prefer the fabric over the like the surgical type mask and the N95?
No, if you can get those, no, N95, yeah, if you can get them, but it's hard, and there are different N95. So we need to be clear on when you say N95, what are we really talking about? It's not going to be the hospital quality N95 mask, which really should be for healthcare workers. But Dr. Nagavi, I don't know if you have some different thoughts.
I think generally the house or the personally made masks are not as effective as level 1, level 2, level 3, level N95 kind of quality. So the amount of protection that it offers the people outside and the person who's wearing it varies from quality to quality. I think if you're wearing a fabric mask at home, it doesn't offer a lot of immunity, but it does protect the larger micro droplets that we are spraying the public with.
Right.
Not the microscopic, but the macroscopic quantity. The quality of the mask are completely different from one layer cloth to one layer surgical mask to 3-layer surgical mask to level 3 mask, so forth. So I think I would personally recommend for every single person from here until this is over to wear a mask. Period.
Agree.
And if you can get surgical masks, they are better than cloth masks, but cloth masks multi-layers with a filter. I don't know if all of these things that are being sold on the internet have any value or more of a farce than anything else. I think that masks that have filters in them, then you have to look at the filter. Is everything in the mask a solid barrier and just the filter is working? That would be great. But then is the filter working, and how good is the filter working for you to replace it? So that's the level of it. As far as I would, I live in a residence where I can get in my car, and at that time, if I'm just driving to somewhere else, I may not wear the mask until I come back to home. But if I'm driving and getting out of the car, I put on mask when I get out of the car and gloves. And when I come back to the car, before touching anything, I take my gloves off. I take the mask off from the strings without touching the surface, and I lay that on the side. I don't bring that mask home if I'm driving and I have a place to put it. Again, if I'm coming home and I can leave it on a surface that is not in my living room and I don't have to touch it, it's much better if I can leave it in a vestibule or something else, so on and so forth. So we have to think that we are if you look at these people that are wearing these bubbles, and think about what level of protection they're getting out of the bubble, and what level of protection we're getting out of a cloth mask, and what level of protection we're getting from a surgical mask, and how we're contaminating the surgical mask with our hand, and then doing this and doing that. So it is a farce to say everyone who wears a mask is protecting something if we don't have surgical sanitary techniques that we carry along with it. But for the sake of everyone, particularly ourselves and others, I think everyone should wear a mask indefinitely until this
I
is
agree.
over. If you look at pictures from China and say, oh, why are everybody wearing masks? And this is 5 years ago. Now we realize, living in 1 billion or more people, there was so much going on that wearing a mask just became the everyday thing. You know what I mean? So I think that everyone, children and adults, should wear masks indefinitely until this is over.
Yeah.
Thank you.
Any other questions? If not, we will
I
stop.
had a question, Aunt Mignon.
Okay. It's another news.
Okay.
Many nieces.
I know. So I just saw a story where the CDC came out this week with new guidance saying that we don't need to be as concerned with the surface spread of coronavirus, and that really just the respiratory, the aerosol spread is really what we need to be focused on, and no longer any need to wipe down groceries or Amazon packages. And I was very surprised to hear that, because that's so different than the way we've been living for the last 10 weeks. Do any of you have thoughts on sort of how we should treat that guidance, how we should be thinking about it?
If I may, I think that we should not be putting our guards down. I think we should put the guards 10 feet higher and make the barrier
Agree.
100 times more stronger. We're not getting better. As I showed you the numbers, this is exponentially growing. To relax rules and regulations is the worst thing that we could do to the people in our general public and worldwide. I think that surfaces are a big carrier. So if you
Yes,
walk
they are.
through a surface, you pick up a piece of food and you're going to a counter, that food could be somebody who was speaking about something or was wearing an inadequate mask over it, or somehow the particle that not only a meter or 6 feet, we have studies showing that 18, 20, 30 feet later, it's still spreading. I'm speaking here, I'm just speaking. I walk 300 feet, somebody comes here in a half an hour where I am, or in my direction, they're gonna get the particles. That's it. So you have to think about this, that wearing masks and gloves is essential, using hand sanitizers is essential, touching your face, your mouth, your nose, and other surfaces of your body, you are contaminating. So it's really, sort of disinfect yourself leaving the house, disinfect yourself coming back to the house. And if you're coming in general contact, clean your mail, clean your packages, clean the surfaces. None of us are perfect, but if we put our guards down, that exponential growth that you saw is going to take us to that 60% of the population being sick rather than in 18 months, in 3 months or 8 months or 4 months or whatever the timeline is. This is not something to fool around with. This is serious, please.
I totally agree with that. I was very disappointed, quite honestly, to see any indication of relaxing our vigilance. We have no data to support that we should be relaxing our vigilance right now. We have to retain that. And I think it's important for each of us to be accountable for doing that. And as some countries are relaxing some of their and opening up, you're starting to see some pop-ups of additional virus coming out again. And we know that's going to happen. And we also know that when we get to the normal flu season, influenza plus coronavirus, we're not sure how bad that severity is going to be. So if we start relaxing things now, and I see a lot of people starting to get comfortable, do not. Couldn't say it any more than that.
And I totally agree with that. Now is the time. If you weren't already a germaphobe, now is the time to be one. I've always been one. So I just feel like this was a wake-up call to learning how to be clean. I mean, wiping down anything that comes in your house should have always been the norm. washing your hands for 20 seconds was always the norm. So when this first came out to educate everyone, I was like, okay, that was normal, you know. But, and then what I see, the glove wearing, which occurred before, which like if you went to a place to eat and they had on a glove, they served your food and then they used the same glove on the register. That is
Or handling the
use of
money.
a glove.
I think that's an important point, because the cross-contamination that can occur from the gloves, people think that they're protecting their hands and they're touching everything with the glove, and then they go and touch something else with the glove.
Exactly.
Proper infection control is you take the gloves off, you put on new gloves before you move on to something else. And that's not what's happening with the majority of people. And I think people are not being educated on the proper use of some of these personal protection things like gloves. So
Right.
hand washing, hand sanitizers, use it like it's, you know, the best thing since sliced bread,
Exactly.
even if you're thinking about wearing gloves.
Right.
And if you have hand sanitizers available, use them for your gloves as well.
Exactly.
If you can't change
Exactly.
gloves, just use them.
Use
Because
it.
remember, you picked up the glove. You touched the glove with your fingers. You put the glove on. Now, whatever you had in your fingers is on the glove.
Now on the glove.
Now, if you use a hand sanitizer, hopefully you cleanse the glove before you get started. One of the problems that we have to sort of deal with is the resurgence of this virus. I think that China
Yes.
probably has millions of infected people,
Thank
just
you.
just like America does. And I think that China is now again saying it's coming back to Wuhan, and they had to close on another
Yep.
150 million people in a
Exactly.
lockdown. So I think that, as I said, if this number of 5 million is 50 million today, if about 5 million people died, I think that's more of a realistic number. And I think if you really take that number and multiply it every month by a multiple of 5 to 10, we may be looking at the reality. Forget the beaches, forget the schools, forget the hospitals, forget the gas station, forget the world economy. I think everybody's worried about the world economy and keeping this going. I think this is World War III. That doesn't feel like a World War III, but certainly the casualties are coming out like it. And certainly the infected people are coming out like it. I think this is the doomsday we were afraid of, but they haven't called it yet. And the numbers are being suppressed and the facts are being suppressed. And I don't think no matter what preparedness we could have, I don't think this is preparable. I don't think the human race was prepared for this. And I don't think it's just the US or anybody else. And I don't think it's the Chinese.
It's a global issue.
It's a good, and I don't
It's
think
a
the
global
Chinese sent it to us. I don't know whether we sent it to them and released it, or they sent it to us, or it just happened really by accident. But I really, really don't think this was just like Ebola, how it happened in a very isolated area. It's like a little bit of an experiment, if you would. How did we deal with Ebola? How many people died of Ebola? Okay, how do we deal with this, and how many people will die of it? I think this whole thing should be really looked at a lot differently than what we're looking at it.
Thank you very much. And let me just say a few words to close this. Sankofa, that means to look back as we progress going forward. Examine and learn from the footprints of our ancestors. Do not repeat mistakes. We are at a turning point in our lives. Should we retreat in fear and timidity or confront the challenges of COVID-19? We have social capitalism versus naturalism, industrialism with advanced technology, and climate change. What we strive for is balance, promotion of atmospheric stability, utilization of natural energetic resources such as turbines, save on our natural resources such as the rainforests, Amazons. What can we learn from ancient and present day tribesmen and women? universal precautions according to CDC. What CDC's guidelines that pertains to clinical environment. We should treat all contacts, everyone we come in contact with, except close family members, as potentially infectious objects. Avoid unnecessary touching. Avoid handshaking, kissing, and so on. Frequent hand washing. In some areas of the world, they don't even have gloves, but hand wash frequently. Routine practice of personal hygiene, even for us here and those in underdeveloped areas. Wash our bodies frequently. Utilize protective barriers as indicated, and if we have them. This is a new age. Viruses are becoming more violent, stronger, and very intelligent. How are we preparing for the challenge? That's it, folks. Thank you very much.
Thank you.
Thank you for
Thank you.
coordinating it.
One
Thank
thing
you.
that I would like
Thank
to
you.
just share with
Thank you.
everyone is global warming is the only thing that has benefited from this by shutting down economies and shutting down transportation and industrialism. I think that's one good thing is coming out of it. Maybe we are saving Mother Earth.
Yeah.
That's the only thing, but it is what it is.
It is what it is.
Doctors,
Yeah,
I
it's
do have a
unfortunate.
question, if I may. A very quick question. Dr. Nagavi, you had mentioned, the spread of particles in the air, when people are simply talking. So, that brings me to the thought of our food shopping, open vegetables, which is usually how they are. How do we, as consumers, properly clean our vegetables when we bring them home from COVID? Normally, we rinse our vegetables, fruits and vegetables, usually with just water. I know that they do have some sort of additives to spray, but I don't think rinsing with water would be adequate to remove COVID from produce. How do we accomplish that?
I think the only thing that we can do without destroying the vegetables and the fruits that we eat, in order to do them, especially, is to wash them with very light soap and water that is organic soap and water that is ingestible. Rinse it well, and then maybe make a container of boiled cooled water and add a couple of tablespoons of white vinegar and rinse your fruits and vegetables for maybe half an hour in order to be able to get the best cleansing out of it. How much of a virus you're going to kill, who knows? At least you're reducing the viral load. Same thing with your packages, same thing with your shopping. I don't know how you would wash bread that is in the open. So things that are possible that you can rinse and disinfect, I think we should do them. There is a product that we are using in the office that turns water and salt into a disinfectant, both aerosolized disinfectant as well as a stringent cleaner that my office is. It's a product. It's a technology that is available out there. Some of you may have it as your washing machine water filters that they use no detergent to filter the water or to use for your clothes washing, that we are now providing to some of our patients, and we're doing experiments with and doing cultures that will be able to treat even MRSA, being a resistant bacteria, but hopefully it will have some effectiveness against viruses as well.
So
A good soap to use, organic, liquid, Dr. Bonner's. It's very good. And you can use that to wash your fruits, your vegetables, and to make sure that you cleanse them. The other thing that I would suggest when you're coming in is clean your surfaces of your counters. Make sure that you're not going to cross-contaminate once you do clean your fruits and vegetables. And then the other thing is, if it is a non-perishable item, leave it in your garage in the bag for a period of time, a couple of days, so that you can get rid of the virus that way, then bring it into the house. And then the last thing that I do is that on bread, I don't buy open bread. Buy it in a plastic bag. I clean the surface of the plastic bag, and then I get those Ziploc bags. I take the bread out and put it in a Ziploc and throw the container away. So there are things that you can start to do that might decrease, I'm not going to say get rid of entirely, but decrease the amount of virus that you're bringing into your home or you're potentially taking into your body. We don't have evidence that it's going to be ingested that is going to be the source of the infection. It's the aerosolization of the virus that is the problem. So those are just some tips.
I just want to add to the people in underdeveloped countries, such as our village, wash and soak the vegetables. Wash, soak, rinse, wash, soak, rinse repeatedly. And then certain vegetables, cook them. Organisms. If an open fire is used, do that. And to destroy the organisms, the infectious organisms. Thank
Right.
you. Thank you.
Thank you.
Thank you.
Thank you.
Thank you, everyone.
Thank you.
Thank you.
Thank you.
Bye.
Bye.
Enjoy your Memorial Day weekend, everyone. Thank
Yes,
you.
all of
And
you.
be safe.
Bye. Take care.
Wash your hands.
Wash your hands, stay safe, and don't touch your face.
Right.